It is shocking to me that 99% of sleep apnea patients are never told about the simple yet life changing blood test to track their progress. Instead, they're left relying on costly, time consuming sleep studies to measure improvements. Even worse, this test, despite being inexpensive, is either completely overlooked or, even if this test is done, most patients never get the critical insights they need. That's why in this episode, I'll reveal exactly what this test is, what the results truly mean, and I'll share simple, natural solutions that have transformed lives. I'm Dr. Dylan Peckus, your guide in naturally overcoming sleep apnea. We're going to go over why this blood test is even important in the first place. And whether it's your first time or your fifth time, make sure you click subscribe so you don't miss a beat and help us share this information with everyone who's in need. So, with this blood test, why do we need this? Well, if you've ever gotten a sleep study done and how fun they are to have all the tubes around you and what's going on, or just to have people, say, "Hey, we set you up in this and sleep easy." Yeah, so sleep studies, they are great in providing highly accurate data. Are they a convenient way to track your progress over time? Not really, unless you love going to sleep study labs or if you have like an insurance plan that gives you like 3 sleep studies a year, it's just not going to work out. Now, don't get me wrong. I'm not saying don't get a sleep study. I'm not advocating against that whatsoever. What I am talking about and this test and why it's so important is because it gives you a way to monitor progress on a smaller, easier to track scale that is also linked up to your body's metabolism. So that is big point because a sleep study is going to be a one-time thing. Most people can only get one, and then it's like the rotisserie chicken of health. We set you up on a CPAP, we set it, and we forget it. Okay, if you've ever seen this late night infomercial, let me know. Then we'll just move on. Well, like you and I, we both know what it's like. But anyway, you're not going to get that really covered, and it is important to eventually get a sleep study because a lot of times when we're working with our clients, it's nice to be able to see and have a piece of paper that says, "Hey, guess what? Your sleep apnea is magically gone." Imagine that. But the reason what we're going to talk about today is so important is because the sleep study results, they're like the tip of the iceberg. And then underneath that are deeper problems in your cells that not only are a reflection of sleep apnea, but also give us different targets so we can improve your mental clarity, your energy during the day, and those other metabolic parameters. So, what is this blood test? It has to do with two major components. I guess it's actually two blood tests, but if you get it at once, that's one blood test. That's my story, and I'm sticking to it. So, this diagram, you may have seen this 13 times. I have used this so many times. It's a great diagram. There are going to be two major components to sleep apnea that are going to cause a lot of the damage. Number one is oxygen levels going up and down. That's really key. Oxygen levels going down will send a certain signal to your body. Number two, with this star over here, is the inflammation that then results from those big swings in oxygen. So, the two stars, low oxygen and high inflammation. Stick with me here. This is going to be a light bulb moment for you. It's going to be very satisfying as we pull everything together here like Charlotte. So with oxygen levels, you have to first look at this hemoglobin. All right, and this is the beginning of your light bulb moment. You may be able to guess ahead of time where I'm going with this. So with hemoglobin, that's going to really be the main thing in which we see how is your body oxygenated. So when we look at research, and here's two studies if you want to go look at it, but I summarized it for you. The bottom line is that the worse your sleep apnea is, the higher your hemoglobin levels, and hemoglobin, I kind of glossed over it. Hemoglobin is this protein inside of your red blood cells that carries oxygen. Very important. Hemoglobin inside red blood cells, it carries oxygen. Got it? Great. Now, the worse your sleep apnea is, the higher your hemoglobin levels go, even if they aren't classically high on a lab reference range, because the obvious one is called secondary polycythemia, and there's another one that's very slight. It's not technically high, but it's called a hemoglobin upswing. That's a slight increase in hemoglobin, still physiologically significant. And that comes down to those two drivers here, right? But just kind of the mechanistic one, two, three is oxygen levels go down in your body at night, and then this stimulates your body to make red blood cells. And then as a result, because red blood cells carry hemoglobin, hemoglobin goes right. Now, number two, so that's the first component. So again, put this into your mind, get the light bulb factory going. Number two is inflammation. We talked about that. Start over here. It's to start over here. There is something in your body that goes up when you have inflammation. There's a lot of things really, but there's one in particular that's going to be important for our discussion here today. I'm going to zoom way in on it. I hope you don't get dizzy. There we go. Ferritin. Ferritin, ferritin, ferritin. Ferritin, you say that in the mirror at night, you can actually raise your levels. That's not true. Beetlejuice is not a Beetlejuice is not medical advice. Ferritin is the storage form of iron, which I am told I say very funny. It's iron. Sometimes I'll say iron. Different inflections. Fun fact about me, when I was in my PhD program, my mentor was German. I think that's where I picked that. Nonetheless, ferritin is something that holds iron in place. Hemoglobin also has iron in it. Okay, the light bulb should be going off. Hemoglobin also has iron. So think of iron as like this thing, and then if it's inside this box, it's ferritin. If it's inside a heme molecule, it's part of hemoglobin. Okay, very important here. Light bulbs, right? In obstructive sleep apnea, here's a study. Here's the graph from the study. On up and down part, that is your severity of sleep apnea. This on the left to right, that's how much ferritin you have. As you have more severe sleep apnea, your ferritin levels go up. There, we said it. Now, of course, if you're a smart cookie, there are other things that could cause high ferritin, but we'll get into that in a moment. Bottom line, sleep apnea severity goes up, so does ferritin. So what are these blood tests? So if you may have already guessed this, you're super duper smart cookie. Actually, I would be really proud of you if you got that. It is ferritin, like we just talked about, and then a CBC or a complete blood panel. Now, depending on different labs, different doctors, and different insurance networks and all that, an iron panel can contain ferritin as part of it. Sometimes it doesn't. I'm not in charge of health policy, how things are. And a CBC will give you information about hemoglobin, red blood cells, and many other factors around that. So that's kind of the light bulb moment of where we're talking about how there's this commonality between the two. This ferritin of iron, and then it will, through a bunch of magical steps, we'll get it into hemoglobin. So they're linked through how your body cannot have good, stable oxygen levels at night. Because when you don't breathe, oxygen goes down, leads to this cascade. So that's the problem here. I guess the problem is, yes, ferritin and hemoglobin. However, it's not just as simple as they're both high, they're both low, whatever. There's actually stages to this that are important to understand. So here's the stages of iron dysfunction in sleep apnea. Just some important details before we get into this. There are other medical conditions. Let's say you have an autoimmune disease that will drive inflammation, and that will confound some of the things we're talking about here. So there's some complexity. And then all the numbers and things we're going to go over, this is strictly educational. This is not meant to diagnose or treat any medical issue. This is for you to know. If you want to talk to your doctor about that, which you should, or whatever your healthcare provider is, do that. Got knowledge? A good start. Good start. It's not the end all be all, but it's a good start. Those sources. It's going to be this article. It's a meta-analysis looking at all the different things, like all the different studies. That is, take a bunch of studies, put them together like a big thing of Play-Doh, look at it, and try to get some results from this. And then the other experience and working with people, but also I'm a hemochromatosis carrier. So if you've ever wondered my slightly bronze skin, which is really more so the lighting here, it's because my ferritin levels typically will trend pretty high around, I mean, they're not as high as they've been, but before I discovered this, they were like 200, 300, and all that. They're in a better range now, like 700. Get to optimal ranges in a minute. So there's 4 stages. So ferritin high, normal hemoglobin. This is just stage 1, where your body is reacting to the inflammation of sleep apnea. That's pretty much it. And then after I go through these stages, I will share with you my experiences and what's been helpful for me with these stages. Got it. That's stage 1. Not super exciting, just ferritin being high because of inflammation. Then stage 2, things get a little exciting. So with stage 2 is where things get exciting, because your body is telling yourself, hey, I need more hemoglobin because I'm low oxygen. So hemoglobin will go up as ferritin remains elevated. So now this iron is being transferred from the treasure chest to the red blood cell, from the ferritin to the red blood cell, then hemoglobin. Next is I did some World-class graphic manipulation here. Stage 3, ferritin is normal or low, hemoglobin is high because we're using up our treasure chest. We're using the stores on hemoglobin. Stage 3. Then stage 4, well, what happens when you keep spending it, right? Your savings eventually run out. So ferritin's low, and then hemoglobin, because we've run out of ferritin. We need ferritin, need the iron inside of ferritin to make hemoglobin. So we run out. So those are the 4 stages. And just some for ranges, 'cause I know I have like normal, elevated, etc. I would say, and this is going to vary per age, per gender, etc. But just overall, we're talking optimal. Okay, we're not talking like these are the clinical definitions because the numbers for iron metabolism will vary country by country for many different reasons. That's a different episode. But for this episode, low is less than 20, high is more than 150. There you go. And here's your table if you like tables and writing things down and having an organization way that. So if you're entertained, before we get into all the great stuff, remember, please subscribe, take your puppy paw. And if you're on mobile, it's this button over here. It's just, well, I mean, this is mobile night view. Just hit that mobile there to subscribe. If you're on desktop, it's just underneath the play bar as well. And if you're on Roku, which apparently 40% of you are, you just have to press up on the button up here. That'll make something pop up. That picture of me. You click right, click there, click subscribe, and you're all good to go. Why should you do that? Because as I provide more videos and updates, you will be able to see them right away. And because this information is incredibly helpful for all the people out there who are struggling with sleep apnea, you subscribing tells YouTube, hey, maybe share this stuff to some more people so they can benefit too. So thank you so much. As we dive into what I have done with all these different stages here. Once again, this is my experience. I'm not telling you what to do. This is not advice. This is my experience and what I've seen. Always speak to your healthcare provider. Now, the other thing is obviously, if you just resolve sleep apnea, great, awesome, all of this goes away. Now, that may take some time to resolve breathing issues and muscle activation and all that. That can take some time. So obviously, we just don't want to leave these metabolic problems to cause more issues because when ferritin is too high, inflammation gets out of control, and then things just fall apart, even whether it's brain fog gets even worse, daytime energy levels get really bad. There's a reason we want to be able to do something about this here. And to do this, we're going to talk about copper. All right. Now, I want to keep it really brief on this. We're not going to get into ceruloplasmin and all these different things. When I'm talking about copper, I'm referring to copper sulfate here. And copper regulates iron. Okay, these metals interact with each other. Think of copper as being in this permissive role for iron. It's used better and more appropriately. Like think of it like this: iron can be this, a dog running around in your yard barking at the neighbors, and copper can be like a nice leash in a way, a nice one. You don't like over restrict your doggy, but something that allows you to like make sure it's going in the right direction and it's not getting too crazy. Simplest way I can put it. We don't need to get into like transferrin, it's transport and ferroport and all these different things. And then also copper reduces inflammation in high ferritin scenarios. Oh, especially high ferritin scenarios. So what has been my experience with each stage? So stage 1, ferritin high, normal hemoglobin, reducing inflammation, whether that is dietary, like omega-3s, turmeric, etc. Those are some things you can consider there, supplementation, or whether it's just good sleep hygiene. A lot of ways to reduce inflammation. I think diet's probably one of the best ones of many. Then you want to think about balancing copper. This can look like, or what it has looked like for me, has been 1 to 2 milligrams per day and some zinc alongside of that. That's just what I've done, right? And then, as possible, boost antioxidants in other food sources, whether that's vegetables or seafood, etc. That's going to be very helpful. Stage 1 isn't like too crazy. This happens, okay, it's going on. Not super duper alarm bells, but still something to be addressed. And then there's also another thing that's very powerful for stages 1 through 3 that I'll share. Stage 2, ferritin high, hemoglobin high. So the only difference here is I found for myself having a little bit more of copper be a little bit more helpful because now you're having more iron floating around, now just in 2 different locations, ferritin and hemoglobin, red blood cells. So want to make sure you offset that. Number 3, as ferritin's getting used up, you're going to go actually just a bit lower on zinc. Why is that? That's because there's an interaction there in which we think like the lead, it's like tightening, if you will, okay? Because all these minerals are, they work together. Now for stage one, two, and three, especially more the ones with hemoglobin high, what some people may do is actually donating blood. Now, if you're really cool like me and you pass out the first time you donate blood, that's why obviously then I entered a career where there's a lot of blood going all over the place. Um, that aside, this is really the fastest track to reduce ferritin in hemoglobin into optimal healthy ranges. Obviously, talk to your healthcare provider if that's appropriate. There it is, and has a lot of great benefits. However, obviously, if you just do that and then you still have the sleep apnea problems, then things are just going to go high again, and you're just kind of chasing your tail a little bit. And so, when in stage four, when we have low ferritin, low hemoglobin, one thing really helpful for me to put into the mix is an actual source of iron. Now, personally, I don't love iron supplementation. It can be very hard on your gut. Getting it from foods or even beef liver extracts or extracts, like it's in a like a desiccated form inside of a capsule. That's gonna be a lot gentler on your gut and easier on you. Now, as you're doing this, it is beyond important to monitor your levels because when I was going through this, just throwing in a bunch of minerals all willy-nilly. And so for myself, I mean, it took me a little bit longer for myself to correct it first time, but then also for clients, being able to correct these things takes about 2 to 6 months or even less than that. Because if you're also correcting sleep apnea just as fast, then it's going to correct altogether way, way faster. As always, I got your back because a lot of times it's a lot of information. Maybe you want to have it written down. That's why we have our free guide. So if you want to get the guide for this episode that has a summary, gives you a little bit more details and some easy examples of how I implemented this for myself, that is available for you here. And then the other thing, if you're interested in being able to correct underlying breathing pattern of sleep apnea, going from fast, irregular, and bad to slow, steady, good, keeping your airway open and helping out with your hemoglobin and your ferritin even faster, that is a sleep apnea reset protocol workshop. So the video workshop, and it also comes with a lot of cool things. You have a workbook there that you can print out so you can follow along the video. And what the heck are you doing in this video? Great question. So I walk you through a series of tests of where we're seeing, hey, what are some of the things we can address with your muscles in your oral cavity, in your throat to help keep your airway open? And then what can we do to help design a good breathing protocol, breath work, so that you're able to correct the breathing pattern and breathe a lot better at night, sleep a lot better as well. So that is there for you. And future Dylan, put the button here like 20 seconds ago. Thank you very much, kind sir. Now, for either of them, if you didn't press that button already, pretty easy how to get them. You've already been around in the description box. You can easily find and navigate that. Just well on, I mean, it's actually a little hard. That's why I'm explaining it on your phone or a tablet. Sometimes you got to press the title and then the description box will actually pop up. Then you click the link to get the free guide. And same thing for the sleep apnea reset protocol. Only difference of making it even easier is that there will be a little picture icon for it that's underneath the description, underneath the comments. I forget where, but that's there. You press that and you're all good. And of course, you're a big fan of using URLs. I have those for you. OCHnow.com/iron iron, get the guide, or to get the workshop, OCHnow.com/reset. And if you're on your TV, you can bring your phone, camera, you know, hover the camera, don't take a picture, but hover the camera over one of the QR codes, that boxes, press that link, and it'll whisk you away to where you need to go. So I'm Dr. Dylan Peckus, and right before you go off to any of these, make sure you click subscribe and then go on your way to either one of those pages. Thanks for watching, and I'll see you soon.